HHS canceled or froze more than $180 million in National Cancer Institute grants. Were you the one to approve these cuts to cancer grants, or did that come directly from the White House?
We're giving the highest, one of the highest budget increases to NCI.
Can you just answer my specific question? Were you the one who approved those cuts, or did that come from the White House?
As I said, we are raising the budget for NCI, for the National Cancer Institute, in this budget. Yeah. It's one of the only agencies throughout my sub-agencies throughout my entire agency that's receiving a raise.
Oh, so Secretary Kennedy, you have the responsibility to tell the truth to this committee, and here are some examples of cuts. In April of 2025, HHS canceled an NIH grant regarding strategies to reduce cancer and chronic disease in the Arkansas Delta. In 2025, a grant selective targeting of pancreatic cancer was cut. In March of 2025, a grant, the automated digital imaging for cervical cancer screening. The list continues to go on. There are 5 rural health centers in Arizona that are at risk of closure because of cuts from this administration. So what are you doing to ensure that every Medicaid patient can access a community health center?
There's 39 million Americans in community health centers, and my personal belief is that it's the most effective health centers in our country.
Absolutely.
What they're doing is better than any, and we're making big investments to make sure that they continue. We've raised the funding in this budget for community health centers, and then I'm finding other pockets of money funnel, as I did last week, $135 million.
I would really like to see the data that shows that, because the rural health communities and health centers in my district are suffering greatly under this administration.
Well, I announced the program.